Congratulations, I'm Geoffrey Siko, Senior Staff Secretary, Minister of Health. I'm also a Gender and Equity Budgeting Trainer, National Trainer among the national trainers in the country. I've moved to different districts, training local governments in aspects of gender and equity, planning and budgeting. Maybe I'll start with the laws that we follow. We follow the Public Finance and Management Act, that is 2015, which compels us to do the gender and equity budgeting, because when you do gender and equity budgeting, we include all people. And the all people we are looking at boys and girls, men and women, people living with disabilities, older persons, and people in hard-to-reach locations. Those are people we are looking at. So in our budgets, if you are budgeting in the health sector, we are looking at if you are constructing health facilities, are we catering for those hard-to-reach regions? We do it, we cater for the hard-to-reach regions. When we are looking at maybe buying equipment, we also cater for people with disabilities. In aspects of midwifery, we are catering for women with disabilities. How are they able to deliver? So we purchase those kind of beds that can help them in labor. We are looking at older persons in terms of the kind of the drugs that they need to use. So when National Medical Stores is taking the drugs to the health facilities, we consider medicine like for high blood pressure, like diabetes. There we are catering for the older persons, because most of them when they go to the private hospitals, the prices are so high. But when they are using the medicine from government, they are able to get them at free of charge. So when we are budgeting, we are looking at the different aspects, whatever we are doing in the health system. Is it family planning facilities? Is it user-friendly services for the youth? We call them youth-friendly centers. In our health centers, we need those special rooms for our youth, so that they are able to share their views about family planning, so that they are able to get information easily than mixing them with older persons, mixing them with children. The planning is a cycle. When we start planning, with the health facilities plan, the regional referral hospitals plan, and then they are called at the ministry for harmonization of their plans. So at whatever level they are planning, whether at health center, whether at regional referral hospitals, they are called at the ministry for a workshop to validate what they are doing. And in such presentations, when they are presenting, is when they say you have left out this one. We are talking of constructing a building at the BOQs at the center. Are they talking about the ramps? If you are talking about constructing pit latrines or toilets, are you considering all the categories of people? So that people of disability have a unit, the boys have a unit, or the women have a unit, and the girls, those separations. In fact, we recommend 5 stars if it is a pit latrine, so that all the categories of people are being considered for. The reason why we look at this is that countries that have embraced gender and equity budgeting have developed 4 times than these ones that just plan and budget for. We call it the budgeting for men and women. Those are that budget for men and women only, and leave out the other aspects of equity. Leave out the other aspects of older persons. Do not develop at the same pace with those ones that are considering those levels. If those ones that are using gender and equity budgeting, if they are developing at the level of 80%, then these ones that are just budgeting normally, we call it normal budgeting for men and women, those ones will be maybe at 20%. So it is a call, and Equal Opportunities Commission, I would also like to say this, has done a lot to this country in terms of training. All local governments in Uganda, all town councils, all ministries have been trained. All ministries have got doses of EOC trainings in gender and equity, planning and budgeting. One of the tools that we use is we have the healthy, we call it healthy compact, that the EOC took time and came up with a publication which shows that in this sector, this is what you're supposed to be looking at when you're planning. So when you look at the health sector compact, it has all those detailed analysis of the gender aspects and equity aspects that you are supposed to be looking at as you are planning. Then also when you look at the Public Finance and Management Act, it is a requirement that all local governments and all central government must comply in their ministerial policy statements. So when we are coming up with a ministerial policy statement, we must make sure that we are targeting the gender and equity aspects. Otherwise, it will not be passed by Parliament. And if it's not passed by Parliament, and if you're not given a certificate of compliance in the gender and equity issues, then you're not given money as a sector. As a sector, we're not bad off. Our scores are good. We are above average. We are above 50%, because we try to integrate. We try to integrate the gender and equity issues in terms of the requirements that are needed. So we look at the compact, we looked at the law, the Public Finance and Management Act, and then we also do what we call the monitoring as we are implementation goes on. We try to look at exactly are we doing the right thing or we're not doing the right thing. For example, if it is a building, we're constructing a building, are the rooms there? Are the sanitary facilities catering for each and every person that we are constructing that facility for? So we are trying to. There are some aspects that you have missed out in the planning. Then you can also somehow, somewhere, modify them during the implementation and maybe finally the completion of the project. So at whatever stage, the gender and equity issues come in, because there are things that we may not plan for. But you're like, okay, if this is a road, how many people are using the road? The youth are using the road, the older persons, the vulnerable persons. Maybe you never put offshoots, maybe you never put walkways. So at whatever level you recall that now I left out this aspect, you bring it on board. So those are some of the things that we look at. We look at the compact. It is just like our key. It's like our Bible or Quran. We look at that compact. It has elaborate, and then we also look at the law. Then we also are supposed to follow the law. And then also the ministerial policy statement must bring out exactly the gender and equity issues which you want to implement. One of the achievements we have got as a ministry is constructing health facilities with ramps. When you move to most of our facilities, people with disabilities now can access those buildings easily without any challenge. Another aspect is that when you look at issues of sanitary facilities, we now put facilities that cater for people with disabilities, men, women. For another success is about the drugs, which I say that when you are giving drugs now, we are looking at older persons also as a package. Although different facilities have different levels of drugs. In Uganda, the situation is that the lowest facility is health center 3. I mean 2. Health center at the parish level. So as you keep on moving to the center 3, they go on getting a better package. Health center 4, general hospital, regional referral hospital, and then national referral hospitals. So we have a package for older persons. Equipments, like we said, if it is beds, we have now come up with beds for people with disabilities, beds for ladies in labor, so that they are also able to use better beds than previous. We just use them to tell them to climb beds, which are used by the normal women, and then they also get some insults. Why are you failing to climb that bed? I don't want to go into those details, but now at least we are looking at aspects of including each and every person in development or in the service delivery. Then also hard to reach. There is no corner in the country where we have not constructed these facilities, especially the health center 3s. In fact, the law says we should construct health center 3 in each and every sub-county. The only challenge is that the sub-counties are so many, we have not reached each and every sub-county, but that is what is in the policy. And if it is implemented, of course, it will reduce on the long journeys. And we have also reduced, that was also another achievement. We have reduced the distance from the health facility to the people when you look at the current statistics, the facilities are now so many. People, at least they are within a radius of less than maybe say 5 kilometers. If it is maybe a sub-county, but even before the sub-county, the health center tools are also in place. So hard to reach, we have given family planning services are there for the youth. In fact, we call them youth corners, where the youth go and they are able to talk to these nurses freely without fearing. Condom distributions are all over, in all places, in order to prevent HIV, because it also brings vulnerability to our people. And there are also others that I may have left out. But as a sector, we think we're on the right move. The impact, one would say reduced death rates, because if people are able to access the services nearer, then they're able to reduce on the chances of death. If people are able to access the facilities, then they're able to get the treatment. That is an impact, and of course, the impact of treatment here is a big thing. What you do when you are okay is a lot than when you are sick. Reduction in distances, people are able to easily reach the facilities compared to the way it was before. That is also a good thing for our people. Then information has also moved out really, because I said it also has trained most of the local governments and central governments. So at least most people now have some knowledge about gender and equity issues, have some knowledge about equity issues, because when we go to train, we train both, like if you are looking at the local government, we train both the politicians and the civil servants in one room, so that when proposals come from the technical people, the politicians do not say, for us, we are not aware about that. We put them in the same room, and then we have a discussion about gender and equity, because we say, when you're talking about gender and equity issues, you're talking about development, you're talking about life. Because I cannot elaborate all the impact that gender and equity does, but you're talking about life, you're saving life, you're improving lives, you're touching lives, you are not leaving anybody behind. Everyone is included in that basket of development. Because once you talk about men and women, you talk about vulnerable people, you talk about older persons, you talk about people living with disabilities, there you have catered for each and every person. If you're having that lens of development, where each of those people are being touched, they are being given information, they are being given access to the service, then you are doing a lot for the community, and that's what we call holistic development, balanced development. But if you're only looking at two people and then you leave the rest, then you cannot talk about development. So in Uganda, we're on the right path. We just need to continue pushing. It is COVID that let us down, but before COVID we used to move. Me, have moved almost the whole country preaching this gospel of gender and equity budgeting. By the way, doctor, it is gospel, real gospel. So when people follow you and they do the right thing, then you'll have achieved a lot. So as Uganda, we have achieved in the few years that we started implementing this and training this. We are training in 2018 as national trainers, and from 2018 to current, I think there is a lot that you can see as we move to our communities. A lot that you can see as we move to our communities. I think I would make the statement that if you want to succeed, you don't look at challenges. Because when you look at challenges, even that 1 feet to move 1,000 kilometers, you will fail even to make that step. So the first step is to forget about the challenges and then you focus. However, when we're in the field, this is what we get. And also I'm going to tell you what we get and also how I answer them, or how we answer as trainers. One of the biggest challenges we get is that people think that gender and equity planning and budgeting must have a specific budget. And we tell them that is very wrong. There is no need for a specific budget. We are budgeting within that budget. Every day they are giving you money. You want to buy 30 beds. Why do you want a special budget for beds for people with disability? Why? Let us just do some little mathematics. 30 beds, 5 for people with disability because maybe the percentage is small, 5 for maybe older persons, and the rest for the men and women. So the biggest challenge that people have, which is a mindset change, which is a mindset problem, they think we need to give them money for gender equity. That money is not there. The money we budget within the budgets that we have. If I'm buying chairs for my primary school pupils that are 50, then I don't need to have a special budget for left-handed students or pupils. I just need to say they are 50. Okay, how many students may be left-handed? Maybe they can be 10 or 5. So let me, out of 50, 45 right-handed, 5 left-handed. Okay, so that's how we have been able to manage and tell people that these challenges you're trying to put across may not work, no special budget. The other is about lack of information. Some people don't know when you say gender and equity, they say these are things of women. In fact, when we go to the districts, they tell us now they have brought, we are going to have a training of women. And we say no, gender and equity planning and budgeting is for all persons. And we mention those persons. So gender and equity planning and budgeting is not for women only. It is for men, it is for women, it is for boys, it is for girls, it is for older persons, it is for locations. Because there are those locations that we neglect. Say those are hard to reach, they are hard to stay. Leave them there. Gender and equity is not saying that. Gender and equity is saying let us balance the equation. Let us balance development. So the issues that normally come out as in terms of challenges can be overcome by mindset change. Mindset change, the money they give you, however little it is, utilize it in the services that you're supposed to do. Don't ask for a special budget. It is not there. If it is about training, we have trained the whole country. The only challenge is that we have a high turnover of politicians. When the term ends, they go, so every time we need to do retraining. And EOC has been whatever providing that facilitation. We have moved from Chisoro to Karamoja to Guru to where training local governments in gender and equity. There is also another team of colleagues that train the central government. I also have other colleagues that train central government. The reason why I train local government is where I started working from. So I understand the parish, the sub-county. I was one time a sub-county chief, assistant cow, then came this way. So I understand the structures the other side. That's why I was picked for the local governments, because they cannot deceive me anyway. Because when they start asking their things, I'm already in the know. You know this way technical people are bad. They say how bad are they? They do this and this, they hide this, they do this. I say no. It's about working together. It's not about competition. It's not about saying these people are bad, these ones are good. When you come to work as a politician, we can learn from each other. The politician has information he has, I also have information I have as a technical person. We put that information together for the development of the country. So me, what they mention as challenges, I don't look at them as challenges. I look at them as things that should tickle your brain, so that you're able to think and you say, okay, there is this roadblock. How do I cross off? How come when there is a roadblock, you'll think of crossing off? But when there is a challenge of money, like now I'm stuck. Not all problems are solved by money. Some are not. Some mindset change. We have an attitude problem as a country. We think when they give you billions of money, then you are developed. They can give you billions of money and you don't develop. We have seen so many people who earn very good money, but there is nothing to show. So this one is about equity planning, involve everyone, forget about those so-called challenges and focus. How do I develop this? I'll tell you a testimony outside. This is that one time I was sub-county chief. I managed to buy land for a new sub-county. And you were telling me, where are you going to get the money? Where are you going to get the money? So what I did, I just called the LOCs and I'm like, you know what? there is this money that they normally give you. We can get an acre in this money. Can we sit, record, make a minute, agree as the council? I left for them land, but other people are not thinking outside the box. Why was I managed to register sub-county land? It is the only sub-county where I was that has a land title. The rest are sleeping. Why there is no money? Do you know why? Because people don't think beyond. People are just comfortable with their seats. Somebody thinks when they are seated there in office, they are working. Working is providing a solution to the people you are serving, because you're in that office to serve. So if people are there in Uganda that think like me, that we can improve, that we can serve, then service delivery will be possible. Then development will be possible. And me, I think development is possible in Uganda. I would be very happy that even other countries like yours come. I pray that they will become benchmarking country. There is a lot to see in this country. There is a lot that you can learn from this country. We have so many experts in this country. There is need to do more training. Even as Uganda, we have done it, but we need more training. You need to set money aside for training of people about mindset change, about gender and equity issues. Because I've told the myth, they think it is for women, but we are saying it is not for women. This is a very, very golden chance that we have for all countries to use and develop. Because for it is telling you, like this SDG thing, no one should be left behind. So gender and equity budgeting does not leave anyone behind. Everyone is in that basket of development. So if you want to develop, if you want to move ahead, embrace gender and equity budgeting in your laws. First put them in the laws, then tell the technocrats, now you're supposed to implement. And when it is implementation, it's about being serious. Because sometimes the challenge we have as Africans, sometimes we are not serious. We make very good laws, we look at them, we quote them, but when it comes to results, impact, you cannot mention them. And maybe the other one is that gender and equity planning and budgeting, a very important aspect, is that it is in each and every aspect. Okay? It is in engineering, it is in financial and administration, it is in human resource. How many women are you employing? How many women? How many people with disabilities? How many what? It is in marketing, it is in education, it is in health, because there is a mentality that it is in agriculture. There is a mentality where people think, this one is in what? Is in some sectors, other sectors are not there. So when you are taking back the message, tell them that gender and equity budgeting is in each and every sector. Every sector can be gendered, every sector you can look at equity issues. Okay? Not equality, equity. That fairness can be in each and every sector. Gender and equity budgeting is not about having dollars of money. It is about your mindset. If you think development, you will develop. If you think negatively, you will not develop. If you think about money only, you will not develop. It is about the attitude. And for us, what we have been doing is hammering that attitude thing. That attitude thing is the challenge. So when you hammer the attitude thing, you hammer the money thing, and some will start thinking positively, a lot can be done, a lot can be achieved. Like we have been trying to show you those aspects. A lot can be achieved. Okay, because you're not living, no one will complain. Because some of these things that we normally ignore, you ignore the elderly, you're also growing old. The people that are old today were also young like us. So tomorrow you're also going to be old. So neglect them today, tomorrow you'll also be part of the culprit. Okay? So when you're making decisions today, you're not making them for maybe those older persons or vulnerable persons. You can also be vulnerable. You can also get sick. You can also get disability in a second. Because, Doctor, I would like to share with you that our country is one of those countries with the highest numbers of what? Of people with accident challenges. Why we are not patient, we are very patient on the road. We rush. In the process, so many people are candidates of disability. In fact, all of us are candidates of disability. So when we are planning, don't say, I'm not disabled. That one is for those ones. Me, I'm not old. Tomorrow you're going to be old. Okay? Me, I'm not like this. Plan for each and every person. Okay? There is also a story being told. There was some very big person in a ministry here in Uganda who said that, whom they told that, you know what, sir? Whatever we need a pension office to be on the ground floor. And he said, no. The pension office should be where it is. You go through the stairs. So when the gentleman he retired, when he retired, became disabled, then he also came to the what? To the ministry to get his pension. So when he came to his pension, they said, hey, but sir, now the office is up there. So he was still now thinking, but how do I go up there? But you remember when we are here, when we told you that the office should be down here to cater for the older and disabled people, you refused. So you can see what happens when we don't balance development. When we think we are doing a favor to this category and then we are leaving this category. So we need to balance the development to cater for each and every person, because even you can be part of that category. It's just a matter of time, and it's a matter of time for you to be part of the category of people. So planning should be for each and every person, and every person should plan with that passion. You know, when you talk about development, it's about that passion. I'm here to serve. I'm serving everyone equally so that everyone gets the service. It is that kind of passion and then the positive attitude that you can make it, we can improve lives of people, you can make a change. Okay? So with those ones, I think those are some of the key requirements that I would put across. Benchmarking, training, mindset change, not thinking about all the money, but thinking about other aspects that can lead us to develop.